Hello everyone, welcome to our channel The Guidance Pro. Vitamin B12 is also known as cobalamin. Vitamin B12 is a water-soluble vitamin that is naturally present in some foods, added to others, and available as a dietary supplement and a prescription medication. Vitamin B12 is required for proper red blood cell formation, neurological function, and DNA synthesis. The average recommended amounts is measured in micrograms and it may vary by age, your eating habits and medical conditions and what medications you take. Infants up to age 6 months need 0.4 micrograms and for babies 7 to 12 months need 0.5 micrograms. 1 to 3 years children needs 0.9 micrograms of vitamin B12 per day and for kids of 4 to 8 years need 1.2 micrograms per day. For children 9 to 13 years need 1.8 micrograms and for teens of 14 to 18 years need 2.4 micrograms and for adults it's 2.4 micrograms and for breastfeeding women they need 2.8 micrograms and for pregnant women need 2.6 micrograms per day of vitamin B12. Some of the symptoms that we see when we are deficient of vitamin B12 are extreme weight loss and fatigue, muscle weakness, loss of appetite and weight loss, sensation of pins and needles due to nerve damage, glossitis and mouth ulcers, breathlessness and dizziness, mood changes, depression, psychosis and irritability, some loss in sense of touch, walking and vision problems and symptoms of dementia, poor vision and memory loss. If you are deficient in vitamin B12, it can cause a wide range of problems like anemia because vitamin B12 helps in red blood cell formation and its deficiency causes anemia and it leads to less oxygen supply to your body. And next problem is nerve damage. This is because vitamin B12 is needed to make myelin, a protective sheet that covers your nerves. Severe deficiency, it can cause irreversible nerve damage and also causes blurred vision. Deficiency of vitamin B12 also causes psychological issues like confused or depressed and it also linked to poor memory and dementia. Lacking vitamin B12 can happen because of a diet containing a poor source of vitamin B12. Especially vegan diet or plant-based diets and dairy-free diets are sometimes lacking in vitamin B12. Another reason commonly causing the deficiency of vitamin B12 is absence of intrinsic factor, also known as pernicious anemia, a kind of protein aiding in vitamin B12 absorption in your intestine. This in turn causes vitamin B12 deficiency in your body. Another reason for deficiency of vitamin B12 is medication. Some medications like proton pump inhibitors can inhibit absorption of vitamin B12. Another reason is removal or destruction of the stomach. Vitamin B12 deficiency can develop in people who have had surgery to remove part or all of the stomach. Overgrowth of bacteria in the small intestine steal vitamin B12 for their own use rather than allowing it to be absorbed by the body and leads to deficiency. Naturally found in animal products including fish, meat, poultry, eggs, milk and milk products. Vitamin B12 is generally not present in plant foods, but fortified breakfast cereals are a readily available source of vitamin B12 with high bioavailability for vegetarians. Some nutritional yeast products can also contain vitamin B12. You can also take a vitamin B12 supplement. It's usually available as cyanocobalamin. Vitamin B12 deficiency can be diagnosed through blood test that checks red blood cell count. People with anemia have fewer red blood cells than normal. Blood samples also checks the amount of folate, vitamin B12 and vitamin C in your blood. Folate and vitamin B12 levels are measured at the same time because these deficiencies can cause similar signs and symptoms. Tests that determine type and cause of deficiencies are antibodies test, that checks antibodies to intrinsic factor, methylmalonic acid test. It measures methylmalonic acid, which is higher in people with vitamin B12 deficiency. Vitamin B12 deficiency can be treated with intramuscular injections of cyanocobalamin or oral vitamin B12 therapy. Guidelines from the British Society for Hematology recommend injections 3 times per week for 2 weeks if patient without neurological defects. If neurological defects are present, injection should be given every other day for up to 3 weeks or until no further improvement is noted. Thanks for watching. Please do subscribe and hit the bell icon.